Hey everyone, today I'm tackling a question that's been buzzing around for a while. What happens when you use Viagra but don't have erectile dysfunction? Viagra, Cialis, and Levitra. You've probably heard of them. They belong to a drug family called Phosphodiesterase 5 inhibitors, and you can't miss their commercials, right? These drugs are designed for men with erectile dysfunction or ED. Since Viagra hit the market in 1998, diagnoses of ED have shot up by 250%. Now, ED often comes with age, obesity, diabetes, heart disease, and high blood pressure, but here's the kicker. More and more healthy young men are using these medications. They're like the guys in those ads, dancing around and seemingly too healthy to have ED. Dr. Rowena D'Souza from the University of Texas Health Science Center says it's a growing trend, and it's a problem. So, what's the deal with recreational use? Some men use these drugs not just for an erection, but to get a longer one. That's not what they're meant for. Doctor shopping and getting unnecessary refills, that's recreational use and plain misuse. A review of 46 articles on this topic found that easy access to these drugs is a huge factor. A quick search online reveals over 6 million hits for internet pharmacies, but only 4% of these sites comply with verified standards. That's scary. Let's talk dangers. These drugs come with risks. Even if you have ED, misuse can ramp up cardiovascular risks, especially if you take nitrates for chest pain, have heart disease, or take multiple blood pressure meds. And for those using ED drugs recreationally, dependency is a real concern. Imagine needing more aggressive treatments like injections or implants in the future because of misuse now. Dr. D'Souza warns that recreational use can even lead to developing actual ED. There's more. Recreational use raises the odds of unsafe sex and sexually transmitted infections. And mixing ED drugs with club drugs like ketamine or amyl nitrite, that's potentially fatal. So, what's the bottom line? Be informed. Don't just focus on the happy faces in TV ads. Listen to the voiceovers about side effects. If you've not been properly evaluated and prescribed these drugs, stay away. Always ask your doctor if you're healthy enough for these meds. Know the side effects and inform your doctor about any other drugs you're on to avoid dangerous interactions. And a quick reminder, an erection lasting 4 hours isn't a good thing. It's painful and dangerous. Viagra and similar drugs are fantastic for men who genuinely need them. They can help over 80% of men with ED. But if you don't have ED, you don't need them. Concerned about ED? Talk to your doctor. Don't turn to the internet for solutions. It could end disastrously. Take care of your health, folks, and stay informed. Catch you in the next video.